Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. So today let's talk about earaches and ear infections, either in adults or children. And earaches can be downright painful, especially when parents are trying to sort of calm down their crying children in the middle of the night. So in this video, I'm going to share with you great tips how to tackle this situation with ease and natural solutions. Enjoy! To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and family, and don't forget to click that bell because it notifies you every time I upload a new video. Now, during the months of May, Medica Nova Online Academy is still offering 20% discount of all home study online courses. So if you want to learn about homeopathy, integrated mental health, health coaching, quantum healing, and so much more, this is the place to go. Check out my website, medicanova.net, at the Online Academy for more information. And if you're interested in a personal health consultation, either for yourself or your children, contact me at health@medicanova.net. So what are ear infections? Well, an ear infections of the middle ear is also called otitis media and often caused by bacteria or a virus. Most often the ear infections occur actually in the middle ear, which is this ear-filled space between the eardrum and the oval window of the ear. The middle ear is also responsible for the transmitting of sound from the outer ear to the inner ear. There can be, of course, outer ear infections, and we call them swimmer's ear. So you feel like you're underwater or have this clogged sensation, or labyrinthitis, which is more a serious condition where you maybe have hearing loss or vertigo. But for the purpose of this video, I want to keep it simple, and we just want to talk about, the common earaches. Now, if a middle ear infection is bacterial, it's often caused by Streptococcus pneumonia, can be virus too, or you maybe just experienced a cold, or maybe you're prone for seasonal allergies, right? By the way, if you want to learn about, natural tips for seasonal allergies, go back to a recent video I just uploaded about that. Basically, there's this congestion and blockage of the eustachian tubes, which connects the middle ear to the back of your throat. And this congestion then can lead to a buildup of fluid or pressure that provides, of course, a perfect environment for bacteria and viruses to proliferate. Now, children between the ages of 6 months to 2 years are more susceptible here because, their shape and the size of the eustachian tubes is just different, or they're still developed. Babies who drink from the bottle and lie down are often more susceptible rather than breastfed babies. Ear infections are most common also during the fall or the winter, the flu season, and as well, with seasonal allergies. There can be mild hearing loss that comes and goes, but often that's just part of the earache, but as I said, it's temporary. But if hearing, even if it's temporary or permanently, is impaired in infants and toddlers, there can be maybe delays with speech, social or development skills even. Now, untreated infections that don't respond well to treatments can maybe create nearby infections, particularly of the mastoid, which is the bony protrusion behind the ear. And then we have mastoiditis, or there can be even a pus-filled cyst. But as I said, we want to keep it simple. If there's a perforated eardrum, often 72 hours, it can be healed. So what are the common symptoms? Well, needless to say, it's pain, right? Especially when lying down. With babies, you maybe see this going on. You know, they sort of slap their ear a little bit all the time, and that means the tugging or pulling it. That gives you an idea that something is wrong. Difficulty sleeping, crying more than usual. They're very weepy, these children. Acting more out, irritable because they're in pain and they want to get rid of it. There can be difficulty hearing or responding to sounds. Most of the time there is fever involved. There can be maybe even a loss of balance. Definitely drainage of fluid from the ear. If we talk about chronic earaches and chronic ear infections, sometimes headaches, loss of appetite because they don't feel well. In adults you have the same, a lot of pain, and most often drainage of fluid from the ear and maybe diminished hearing. Now, according to the CDC, middle ear infections may not need antibiotics in many cases because the body's immune system can fight off the infection without help from antibiotics. And please remind yourself here, if it's a viral infection, antibiotics won't work here anyway. But many doctors are often unsure if it's viral or if it's bacterial. And then a typical course of treatment for children under the age of 6 or for those with a severe middle ear infection, for 10 days is prescribed. But let's try something more natural, right? And maybe you don't need then the antibiotics in the first place. But before we're going to go into the natural protocols, I want to share with you some food for thought. And I want to talk about some metaphysical meaning of ear disorders. And it gives you also an idea, maybe there's a story behind my reoccurring earaches. And when I researched it, according to Jacques Martel, ear disorders occur, and he describes it in the first person. He says, when I feel sorrow, when I'm irritated or feel hurt by things I've heard. I may also have the impression that nobody listens to what I have to say, or I'm disappointed about what I would like to hear people tell me, but that nobody ever tells me something nice like a compliment or thank you. It is as if I wanted to lock myself in and no longer be in contact with what surrounds me. Maybe I'm the one being obstinate and refusing to hear what others have to say. What am I hearing goes beyond my understanding. If I'm annoyed because there are words or information that I was unable to receive or hear, for example, because of noise or hubbub around me, and these were of capital importance to me, for instance, to make a decision or follow a direction, my anger or my frustration will cause an ailment in my ears. There's a communication breakdown and noise. There's often a conflict related to the mother, which manifests itself by an ear ailment. An earache occurs following criticism that came to my ears and was aimed at me or at someone else. What I hear makes me anxious and hurts me physically and emotionally. If it is an ear infection, I probably heard words that caused me to feel irritation, an emotional upheaval, conflict or disharmony. My ears react strongly when I hear people I love who can't get along with each other or can't come to an agreement. If a child experiences an ear ailment, this may express a conflict related to the family or the school environment. Earaches are frequent in children who hear everything adults are saying. Their parents quarrels without being able to give their own point of view. That's a classic, isn't it, don't you think? He continues to say, I may hear different versions of the same story, and this greatly troubles me because I don't know who to believe. Earaches may also manifest in adults who have difficulty with oral communication, especially If I feel disgust about using a telephone maybe. I may have difficulty in closing conversations that I find dull or dealing with the same issues endlessly repeated. My ears may become blocked if I want to hide and seek refuge inside of me, and I no longer want to hear anything because it hurts too much or it's too disturbing. So what would be the positive affirmation? He would suggest, it says, I accept to discipline myself and lend an ear to everything around me and especially inside of me. I learn to keep my ears open at all times while developing my capacity for detaching myself from what I hear. My heart can thus remain constantly open. I really wanted to share with you the metaphysical meaning of ear disorders because it's not or may not always be a physical symptomatology. It's maybe the body is expressing something you didn't want to hear in the form of an earache. So really dig a little bit deeper here in your life and see where this is coming from. So let's dive into our natural treatments. I personally think garlic and the combination with mullein oil is the best treatment here as external applications. Garlic or garlic oil, multiple studies have demonstrated garlic's potent, its antimicrobial, antiviral, antifungal properties. It's also been shown to have a highly positive effect on immune health. It's like nature's antibiotic. And really, it helps to get at the root of the ear infection and kills these offending pathogens. I like it in combination with mullein, wonderful plant called Verbascum thapsus also. And the oil is made from the flowers, well known to tackle earaches. And a tincture containing mullein, either alone or combined with other herbs, in this case garlic, is commonly found also online or in your health food store. You know, if it's combination with garlic, sure, it smells a little bit, but hey, I'd rather have the garlic smell around me than they have the earache. So what you're gonna do, you're gonna tilt your head a little bit to the side, you know, put a few drops of the oil in there. And what I would suggest is so you pull a little bit on your earlobe, so you hear this clicking sound when you put it into your ear, and that means it drains down the lymphatic system really nicely. And then you stop it up with some cotton wool, particularly during the night, because you don't want to mess up your pillows. I also want to bring in probiotics. Probiotics can help to prevent ear infections. So we want to also talk about, if you have a susceptibility towards it, how to create a preventative measure here. According to the Mayo Clinic, certain strains of these great bacteria which occur naturally in the body may help prevent ear infection in infants and children. So probiotic, Acidophilus in the morning would be highly recommended here. I also want to say diet and food allergies, especially if you're prone to gluten, dairy intolerance, if you really can't break down any even nut allergies, that could be a part of it. It's worthwhile to invest maybe to get an IgG food sensitive test here. It can show you, if you're sensitive to any food allergies, food sensitivities, or food intolerances. I think the most one which I would think of would be mucus producing food here. And here I would say dairy, right? Maybe switch to goat's cheese or goat milk, or just replace the cow's dairy products in general here. I also want to bring in vitamin D, because it has the ability to boost your immune health in general. And research has shown specifically that it can have a great impact, beneficial impact for ear infections. So what is the best supplement protocol? Well, I would bring in, of course, garlic and mullein oil, or if you just get the garlic oil separately, that's fine too. I would say 2 to 3 drops, into the ear twice a day, and zinc, 10 milligrams, maybe twice a day for children older than 2 years old. Vitamin C for sure, 1,000 milligrams 3 times a day for adults, 500 milligrams maybe twice a day for children, from 6 to 12 years of age. You also want to bring in vitamin D3, always great to have to boost your immune system. I would say 400 IU to 2000 IU daily, between the ages from 2 to 12. Of course, you bring up the strengths the older the children are. And of course, if you experience dizziness, vertigo, hearing loss, or more stronger symptoms, and it goes on for a few days, please contact your healthcare practitioner or contact me at health@medicanova.net. Let's finish this video with my favorite subject, homeopathic remedies. The combo of natural supplements and the suggested homeopathic remedies is a perfect package how to tackle acute ear infections. Now the idea is here that you match your individual expression of the earaches with the suggested remedy. When you find the match, it works. And with children, look out, because sometimes they can't express their symptoms, they're too young yet. Look out which side of the head is affected, right? Is there fever? And all that gives you a great sort of it's just like a plan, like keynotes, how to find the right remedy. The dosage plan, I would say, over-the-counter remedies, potency 30 in adults, 1 tablet every 2 to 3 hours, maybe for 1 or 2 days. In children, 1 tablet maybe 3 times a day for 1 or 2 days. But please always contact your healthcare practitioner or me at health@medicanova.net. I'm happy to help, and leave your comments below if you need more advice here. The first remedy I would start is Belladonna 30. Great remedy. And here you want to look out for intense earaches that come and go suddenly. 3 times underlined, suddenly. You feel like, oh my God, I have this throbbing and pounding pain. You want to put your hand against your ear because it's like dun, dun, dun. It's this pounding specific expression. The person usually has a fever, especially with children. There can be a flushed red face. The eyes are very sensitive to light, maybe, and the skin is very hard to touch. Often the right ear is affected, and that's really important with ear infections in children. Right? There can be the left side, the right side, but here it's often the right side, and you have this throbbing pain, and the child is really miserable. There can be even nightmares, because the child is just, or a fever, or delirious fever even, because the child is really affected. On the other hand, if you see a left-sided earache and the child is very weepy, very clingy, you want to think about Pulsatilla 30. Fantastic remedy. It often it's indicated for ear infections that follow or accompany a cold. And the cold, you have this yellowing, greenish discharge coming out of the nose. The ear maybe, feels hot or is swollen even. It feels like as if there's something pressing out. Pain can be worse, absolutely more around the evening and the night, as well as worse from heat. There's also this pulsing sensation. There can be itching in the ear. And often you see in children more chronic ear infections, and the personality is that they feel really miserable. They want to be carried. They want to have company. They easily cry. Very different from Belladonna. Belladonna would be angry and, irritable and fever. It's very hot remedy. Whereas with Pulsatilla, it's more, I just want to have, mommy, and please help me. This kind of personality picture. Camomile 30 is also a great remedy when you have earaches which are associated in children with teething. There can be irritability and hypersensitivity to pain. I mean, they are downright angry and frustrated. They will throw the bottle, throughout the room and say, I just want to get rid of this pain. Camomile, doesn't matter if it's left or right side here. It's about the intensity of the pain. So, and especially if teething is involved. So now we talk a little bit about remedies which have to do with chronic ear infections. Now, before I said that there can be also drainage or fluid from the ear. If you see something like this, you want to think about Hypersulfuricus or calcareum. We call it Hyperself in short. 30, fantastic remedy. If you have sort of advanced stages and there may be even a bulging of the eardrum, pus formation. The keynote here is this splinter-like pain. So you swallow and then you have this knife-like pain shooting up into the ear. So needless to say, the person is very sensitive to everything, can be even to cold, to drafts. They feel extremely vulnerable and touchy. Of course, because now you have a pus formation. Also the discharge which comes out of the ear has a sort of smell like cheese. I know it sounds a bit gross, but we want to be really specific here in order for you to recognize the remedy. So we have discharge, right? And it's a very splinter-like pain. So remember Hyperself. If you have, again, an advanced infection with pus formation, shooting pain, but there's more roaring in the ear, you maybe think about Mercurius solubilus, Mercurius 30. Again, a remedy you can get in your health food store. Often here the person is very sensitive to temperature. That can be hot or cold, and you have swollen lymph glands, right? We have very offensive breath by then. Maybe you have a puffy tongue, sweat and drooling maybe during the sleep, like the saliva is coming, sort of dripping out of your mouth when you put your head onto the pillow during the night. But there is ulceration, right? There is like really, decay happening. I often have really great results with Silica 30, great homeopathic remedy, especially for chronic cases where the pus is quite offensive and thick and yellow-green in color. So Silica or Silica really absorbs pus, and the eardrum may be even perforated and there's roaring and hissing sounds in the ear. At this stage, your child probably would be prone to surgery, right? And maybe used to have we call it grommets, plastic little tubes inserted in there in order to keep the ear canal open. Silica is a wonderful remedy, so you even don't have to go into surgery most of the time. Of course, there are other remedies like aconite, napellus, when you have an earache stemming or caused from a cold. If you have a low-grade fever, maybe ferrum phos. But as I said, we want to keep it simple. I think if you feel like you have a swimmer's ear, I would suggest Collymore. Go and get the biochemic homeopathic tissue or cell salt in your health food store. It comes with Collymore 6X, really nice remedy for when you have this cracking sound in your ear, or it's called swimmer's ear, where you feel like clogged, sensation, or you feel like being under the water. So I think that's enough info for your home pharmacy today, and let me know if this video was helpful to you and leave your comments below. Now, please always know if you need some help, contact me at health@medicanova.net or the website medicanova.net. Now, in the description box below, I leave you also a recommended supplier called BestMadeNaturalProducts. They offer really a nice, effective eardrop. So if you want to look out for that. So till next time, much love and enjoy your hearing. go a little bit inside yourself and, explore a little bit. Is there something I don't want to hear in my life? So I wish you all the best. Take care.